Central auditory nervous system undergoes maturation within different time frames. And if we look at the responses of behavioral observation audiometry, these are the clinical findings which are performed by audiologists in a two-room setup. And the infants respond to sound, they can hear. And if there is a presence of hearing loss or absence of hearing loss, which can be easily understood well by the audiologist through behavioral observation audiometry. Altogether, it's a difficult matter of concern to understand whether these responses are completely behavioral and noted completely clearly well, and then to know the presence of hearing loss within the time frame. Is actually the hearing loss present or not present? This is not very clear with BOA. And the anatomical structures that we see from the peripheral auditory nervous system pathway to the central auditory nervous system pathway. All through this pathway, the maturation is going on ever since from the time of birth. And from the time frame within early 6 months as well, the myelination is just started for the axonal neurons. And from 6 months to 5 years, again, we can observe through behaviorally, through the subjective impression, the subjective impression that we take during case history for a patient. We do understand that there is a language which is missing, or the perception, auditory perception also showing gaps. So through that, do we understand there is a presence of hearing loss, or yet we have to understand that from 5 to 12 years of age or beyond that age, there is existence of CAPD as well. And CAPD, if it exists in presence of hearing loss or without the presence of hearing loss, it can yet exist. And it is the degraded speech which is not well understood, or it is the speech which is not understood, perception is not there clear in the presence of background noise. And it is all because from the brainstem, from the auditory nerve to the cortex, the axons are under maturation even after beyond the age of 12 years as well.